Utah, you're getting your money back.
You, the taxpayer, got your $800,000 back for the $140,000 hydroxychloroquine that were purchased.
We uncovered the state's controversial $800,000 purchase.
Utah taxpayers could be on the hook for this drug that we don't even know is effective yet.
And we didn't let up, even when leaders didn't want to answer.
Listen, Jim, the public deserves this.
In good times and bad, trust 2 News to hold the powerful accountable. Thanks for joining us for 2 News at 10 tonight.
We do have team coverage for you to get you updated on the very latest coronavirus developments, including it was a big day for Utah as state leaders make a huge investment in an unproven drug to treat COVID-19.
What the state did was purchase a large quantity of these drugs so that if there are providers in Utah who want to treat their patients who have COVID-19 with hydroxychloroquine, they have the capacity to do so. So these drugs will be distributed through pharmacies, no charge to the patients, and if a prescriber does want to prescribe it to their patient, they're able to do so.
Yeah, but some Utah lawmakers don't see eye to eye with state epidemiologist Angela Dunn, saying the malaria drug could do more harm than good.
Jim Spiewak talked to a representative who's also a physician tonight. Jim?
Yeah, Representative Suzanne Harrison told me that Utah taxpayers could be on the hook for this drug that we don't even know is effective yet. The state will soon be the owner of 200,000 units of hydroxychloroquine. It's thought by some to be a potential drug to help COVID-19 patients.
When we don't have the medical science to back it up, I feel like it's irresponsible to be using taxpayer dollars for something that we don't know if it works.
The FDA said this drug should be used in the context of a clinical trial right now. Representative Suzanne Harrison is also an anesthesiologist. She says a number of recent studies show the drug could be potentially harmful.
This is too important to get wrong, and patient lives are at risk.
The health department says the medication will be given to local pharmacies across the state, free to patients with a prescription certifying they have an active case of COVID-19. But Harrison says there's already plenty of supply and access. What would be the purpose of getting 200,000 units of this right now?
Great question, Jim. I have the same question, and it's a concern.
Harrison says there have been warnings from infectious disease doctors and epidemiologists.
Those people are crying out and asking for the state to not participate in these types of contractual arrangements because it's not needed.
Now, a spokesperson with the Utah Department of Health says that the contract is not entirely finalized just yet. So when we asked about the total cost of this contract, they said they'll release that information only once the contract is final. So still some questions to be answered here. Guys, back to you.
Our new details just coming to light about an anti-malaria drug for potential treatment of COVID-19 our state bought 24 days ago.
Yeah, we have team coverage for you here in Utah and in the nation's capital as well.
It is a deal that was never open to the public, but you are funding it. Jim Spiewak found out the deal was for about $800,000. Jim?
Yeah, I got a copy of the contract. It's right here, and what the governor's office and state is calling a rapid fire decision for 20,000 units of hydroxychloroquine, which the state also told me earlier tonight they have not taken delivery of yet. Behind closed doors, with the public not knowing who has a seat at the table, decisions are being made and taxpayer money is being spent.
We should be making responsible decisions and being transparent with those decisions as well.
This purchase order shows on March 31st, the state of Utah bought $800,000 worth of hydroxychloroquine. The public is just now finding out about it, and I took it to Chase Thomas, who runs the watchdog group Better Utah.
This is still a little concerning that the government went ahead and made a huge purchase like this without anybody really knowing.
It was also recently discovered the Utah Health Department is negotiating for 200,000 units of the same drug from the same company. That deal has not been signed yet, but this is a different deal entirely.
I think for Utahns, it just shows that we need to hold our government officials accountable and make sure that they're doing what's right for our state.
The governor's office denied an interview request about this purchase tonight, but Paul Edwards, a COVID community task force spokesperson, sent me a statement instead saying in part, in the early days of the crisis, the governor's office of management and budget was authorized to make rapid fire decisions about strategic purchases in support of the state's response. And earlier today, during the special session, lawmakers blocked an amendment that would have put a cap on how much the state can spend on non-FDA approved drugs, which now paves the way for the state to spend up to $6 million on drugs just like this one. Now, the statement that I received from the COVID task force, I've put it on our website in its entirety over at KUTV.com. Guys, back to you.
Jim Spiewak with the two top office holders saying today they didn't know about this particular purchase.
Yeah, so as this started to come to light, Lieutenant Governor Spencer Cox said that he wasn't available for an interview. Obviously, as the head of the COVID-19 task force, we had some very specific questions, but through a statement, he says he did not know about this purchase, going on to say he doesn't know every contract that the state executes.
One of the things that's come up here in the last really 24 hours, and that has to do with our hydroxychloroquine.
$800,000 worth the state bought 25 days ago that the public is just now finding out about. Governor Gary Herbert says he's just finding out about that buy, too.
But we had pros and cons happening, unbeknownst to me, that we actually had, of course, we had this emergency authorization that we have with our health department for these kinds of situations.
The purchase was made through the budget office.
We had people certainly pushing it, and people thought there was some hope there.
The governor says he's not sure how or why the state ended up using the pharmacy they did, Meds in Motion.
Just a little reluctant to say how we got involved, because I don't know for sure, although I've heard different stories. And so why don't you just hang on for next week and we'll be able to maybe clarify some of those things.
A month ago, the state did an inventory of hydroxychloroquine. Multiple pharmacists told me today there's been ample supply. The governor says there was concern supply could run short.
So that seemed to be kind of hedge your bet kind of a thing. I'm not sure that that all was correct.
Now, throughout the day, I've seen copies of multiple discussions by infectious disease experts concerned about this specific drug. This while at the exact same time the state was purchasing a large quantity of it, we now know, for $800,000. Guys.
New details tonight in a chain of emails from medical experts concerned about hydroxychloroquine before the state spent $800,000 on it. The concern from an infectious disease expert was not sent directly to state leaders.
And that warning found its way to state leaders anyway. And Jim, you've been looking into this for a couple of weeks now.
Yeah, that warning got to them at least on paper, according to these emails. Now, I reached out to the lieutenant governor's office first thing this morning for an interview request. That request was denied. Then, during the governor's daily briefing earlier today, was never given an opportunity to ask questions about some of the concerns raised in these emails.
But that, again, those are questions that we're going to have to review here.
And what the governor has already said may have been a mistake. This is all he would say today about the state investigating itself into an $800,000 purchase of hydroxychloroquine.
As I mentioned to you last Friday, this issue is under review, is still under review. Everybody's been very cooperative and collaborative on this issue, and I'll probably have something to report on that in the next day or two.
These emails from March 24th from an infectious disease expert writes in his individual capacity and not in that of his employer, quote, I have recently become aware of a plan by a group advising the governor's task force to make hydroxychloroquine available directly to the public. The email asks the original senders they demand the task force answer 15 pressing questions before moving forward, adding, quote, to make an unproven drug available to the public independent of diagnosis and without a physician oversight and safety monitoring sets a dangerous precedent. 2 News discovered this email made its way to state epidemiologist Dr. Angela Dunn. Dr. Dunn responded by writing she agreed with the concerns and she received similar feedback from a variety of experts but had no authority to issue standing orders. Dr. Dunn then included Governor Herbert's chief of staff, Justin Harding, on the chain 7 days before the state's purchase, and that's where the chain of command ends and the answers have stopped for now. So as for this investigation, really who is in charge here? I reached out to the Attorney General's office to ask them about it. They said this is more of a policy issue, not a legal matter, to reach out to the governor's office. When I reached out to the governor's office about the investigation, they told me that it is being solely internally reviewed by the governor's legal team. So still a lot of questions here. We will keep asking. Guys, back to you.
Welcome to 2 News at 6. We are following breaking news tonight. In just the last hour, we've learned that the state's $800,000 purchase of hydroxychloroquine has now been refunded. Jim Spiewak's been following this story for weeks now. And Jim, what can you tell us about all this?
Yeah, so we know that the taxpayers got their $800,000 back. This purchase was made on March 31st. It was really done behind closed doors. The public didn't know about it until more than 3 weeks after the initial purchase. So once that came to light, a lot of questions were asked. The governor said he was going to begin to review this. Here's what we know now. According to the governor's statement that we just received, the $800,000 has been refunded in its entirety. The statement from the governor goes on to say that we have determined that all involved acted proactively, preemptively, and prudently during this emergency in an effort to save lives. The statement goes on to say they admitted there were breakdowns in communications between state agencies, but all involved acted in good faith. The statement does not go on to specify what some of those breakdowns in communications were. Also from the governor, they said that the review underscores the challenging decisions made by Utah officials in the early days of this COVID-19 crisis. There have been a lot of questions, Mark, about how this particular company actually came about getting this contract from the state. There was no bid process in this, and the statement addresses that, saying under both the governor's and the president's emergency declarations, the normal bid process is not required for purchases needed to address this pandemic. Nonetheless, the state purchasing department is required to exercise caution and afterwards justify their actions. I also just got off the phone with Dan Richards. He is the head of Meds in Motion, this pharmacy that the state bought this from. He told me very briefly that he thinks that this was a fair price because of the different combinations of drugs that were offered. He actually says it was under fair market value that the state got. He says that this was all done at the state's directive. So still a lot of questions surrounding this. We still are going to be asking a lot of those questions and be getting more answers for you throughout the day. Big takeaway, though, you, the taxpayer, got your $800,000 back for the 140,000 pills of chloroquine and hydroxychloroquine that were purchased back on March 31st. Mark?
All right, Jim, thank you very much.
Sold Utah $800,000 worth of hydroxychloroquine, then returned the money. Says he got left holding the bag.
At the same time, the head of the COVID task force says changes have been made to make sure this doesn't happen again.
Jim Spiewak has been in front of this story since the beginning. And Jim, you spoke to the head of Meds in Motion, also the lieutenant governor tonight, about this refund.
Yeah, it's been almost 1 month to the day exactly since this deal was officially signed. A lot has changed in that time. Probably the biggest thing that has changed is that between the contracts that have been signed and those that were still being negotiated, the taxpayer has now saved $8.8 million for a drug the state now says they don't need.
This is definitely a special deal.
Which Dan Richards, owner of Meds in Motion, started back in March.
We did it to help the state, and it didn't work out, and we move on.
Richards says he and an outside group comprised of people from Silicon Slopes connected with the governor's budget office and state health department about selling chloroquine and hydroxychloroquine.
And decided to obtain a supply which we believe would be adequate to create a safety net.
The deal was signed with no other bidders at the table. Several independent pharmacists I spoke with told me the state overpaid. Richards says it was a fair deal.
We're talking about a custom compound made at the state's request in a mass quantity.
Lieutenant Governor Spencer Cox says his focus at the time this deal was made was on testing and PPE.
This purchase was never brought to the task force. There was never any approval or recommendation from the task force.
Cox says the task force has since changed structure. All major ideas are discussed at a daily morning briefing. So with that structure, then something like this would have come across everyone's radar.
Yes, that's the exact idea behind the incident command structure, so that every team knows what every other team is doing, and if there's something that's of concern, that can be brought up right in that meeting.
State leaders admit mistakes were made and there was a communication breakdown. Cox says no one was disciplined.
Some people may make the wrong decision, but as long as they're making it for the right reason, then that's okay.
And tonight, the taxpayers have 800,000 reasons to be happy. Now, Meds in Motion is licensed to sell to one patient at a time with a valid prescription. Richards went on to tell me earlier tonight that This deal that he made with the state was to allow for a distribution system to be able to move this drug in bulk. Guys, back to you.
Been looking into the state's no-bid contracts for weeks now.
Yeah, so there's still questions tonight over the state's $800,000 hydroxychloroquine purchase. This at the same time, there are still questions coming from lawmakers tonight about more transparency and more accountability. Today, Governor Gary Herbert said this.
I believe there are legitimate questions that have been raised about various contracts that have been entered into by the state.
And then he said this.
Certainly, for any questions that may be out there, we will cooperate with any legitimate inquiries to evaluate and to learn from the decisions that have been made.
His office wouldn't answer my questions over the last couple days, and a public records request confirmed there's no paper trail of his own investigation into what went wrong with the state's hydroxychloroquine purchase.
It's really a meaningless audit if there's no record made of what the report found.
After his internal review, Herbert said there was miscommunication, but everyone acted in good faith. But Representative Brian King says the public still doesn't know who was calling the shots.
The public absolutely has a right to know who's got a seat at the table and who's making the decisions.
The state would not answer follow-up questions, specifically asking who was involved and what the communication was the governor referenced. State statute doesn't require an answer be provided if no supporting document exists.
I think it draws into question whether this was a serious review. I mean, if you're going to have a serious review, if you're going to have a review that makes sense, if you're going to have a review that's really meaningful, you'd think that there'd be some report written up.
Now, throughout the day, I also reached out to the Republican leadership, including House Speaker Brad Wilson. Those requests were not immediately returned tonight. Now, let's also remember the state auditor says that they are conducting their own review into these no-bid contracts, so we will continue to wait for those results. Reporting outside the Capitol tonight, Jim Spiewak, 2 News. Guys, back to you.